Hello. Uh, I'm just going to do a short video about Bell's Palsy. I've had it for 8 months. It's now clearing up. I'm almost 100% over it. There's a few little defects that I'm still having problems with. My eye. I can close that one. That one. I can do that. I can sneer, sneer. Smile to some extent, but not. It's not great. Nose is a bit wonky still, but it's come a long way. I wish I could have shown you pictures of what I looked like before, because I looked a right mess. The face was all over the shop. Anyway, this video is really to sort of tell people, like new people that have come down with this, sorry about that it will go, and just because mine lasted 8 months, it was only because I didn't try. I kind of gave up a bit. I had a lot of stressful situations happen, and I kind of got a bit lost, and didn't do all I should. Stopped the massaging. I was taking vitamins, and then I stopped taking vitamins, and basically I just kind of lost the plot with it. I had a lot to do, a lot on my mind. Um, I'm going to try and make this video short because I know I've only got 10 minutes. So this is really, I promised the people on a couple. Yeah, I promised the people on a couple of forums that I would do some exercises that have helped me. Um, I'll try and be quick about this and maybe do some videos later on. So unfortunately I can't show you what it looked like beforehand, but I will put some pictures up to show you. Right, firstly, one of the things that you first get when you get Bell's palsy obviously is you're paralysed on one side of the face. The worst affected is the eye because it sags down like that and it doesn't close, the lid doesn't close, and the mouth. The mouth's like, it could be down, up, I can't remember, that could be dropped, this could be up like that sort of thing. But it's going to take time to get better, and that needs to heal up before you start doing any exercises. If you do any exercises, just make them very gentle, just very soft movement, upward movements, using like some sort of moisturiser cream, and making sure your hands are always clean, because you don't want to use you don't want dirty hands. You get infection in the skin and right. Anyway, right, what I really want to concentrate now is, like, a lot of people I've noticed on forums have said that they've got trouble closing one eye, closing the eye that's affected, or the eye is bigger. That eye is actually appears bigger, but what I want to say is it's not actually bigger at all. I mean, it is to a sense, but your eye hasn't expanded. It's not got any bigger. This is the important thing. I had this, and what I did is I got 2 fingers and rubbed underneath and underneath. I can't do it with one hand, but underneath the eyebrow, around there, is usually tight. You can feel there's a tightness right round, under, sort of there, around there, mainly there, and above the eyelid, around there, just there. Keep on rubbing it, because if it feels tight, it's knotted, it's tense, and that's tense. There's tension all around that eye, and when there's tension all around that eye, especially above here, it tightens up, and therefore, because it tightens up, the muscles go from right back round the eye, they tense, and they push the eye out, You know that guy on TV, the black guy, where he can make his eyes pop out. Yeah, well, it's like that. The muscles are behind and they can make it push out. So you need to relax them muscles, and just by rubbing, there should be an ache or something, and that'll reduce that, and the eye will go back in place. In fact, it'll probably set even lower than it was before, because the other eye has got a slight pressure to it, so it comes up a little bit more. Anyway, that settles down, and my eye has. Quickly of the mouth, I'll try and be as quick as I can here, because one time's running out. Right, your lips up here, is it? Or down there, you can't talk. Or your bottom lip, you're having trouble, you can't close your mouth properly. I mean, I'm still talking slightly on my left side a bit. Not quite there yet, but I can't whistle right now, but basically there's tension here on the chin and around the lip, and you need to loosen that up using the two fingers like that. Under there's a tightness, there should be a tightness. You loosen that up like that, round there, then onto the chin, loosening it up. There should be a stiffness. You tighten that, untighten that tautness, and around here, all around here. This is for the lower chin and the bottom lip. If you do this enough, you should start to feel this lip raise. It should raise up. It should raise right up, or drop, depending on how it is. And you should start to see them lower teeth. The lip will also become more fuller. Top lip quickly, right, around the lips, again around the bottom as well, at the top. You need to put pressure on there. Sometimes you'll find that there's a tightness there, or a tightness around here, which needs to be in the cheek. Two fingers again, rotated round like that. Rotating motion. Quite hard. You must put quite a lot of pressure on there, and then around here and around the nose, under the nose, because it's like a tight knot, and once that just gets tighter and tighter, and you have to loosen that until it becomes completely unrigid, or it's not really a word, but until it becomes loose, and you'll find that starts to drop, and it becomes more relaxed, until that you can make a kissy face like that, purse your lips. Some of the nose, working round the nose, circular motions, above the eye, like that. There again, under the chin, round here, along here, where the myelin sheath is, where it's damaged. You need to sort of supple it up, keep the blood flow circulating. Remember, vitamins B complex, B12, C, and omega, fish capsules, alfalfa. There's a number of other things like vitamin E, magnesium. There's a list. I've got it on 2 forums. Bells Palsy sucks, and recovery of Bell Palsy, I think it is. I'm with a number of forums anyway. They're both very good. I suggest you go and join, go on Facebook. You'll see them. Put a search out for Bells Palsy. You'll see these 2 sites. Some wonderful people who are on there, very helpful. They've helped me out. And search YouTube and that lot. And I'll make another video a little bit more, maybe intuitive. I can show you a little bit more, maybe tell you a little bit more. But just remember, there. You're going to be alright. You'll get over it, and the chances are you'll be over it in a few weeks, maybe. And if you're not, hang on, because it could be the week after.